Today we'll be talking about postpartum depression and baby blues. To help us with this topic, we have a special guest, Dr. Jess Galton, who is a neonatologist and CEO and founder of Mommy.
PAK Pediatrics presents.
Hello everyone, I'm Dr. Jeffrey Kyle from PAK Pediatrics.
And I'm Dr. Alvaro Raimunde, also from PAK Pediatrics.
And today let's talk about the baby blues and postpartum depression. And that is something I think that, we thought was really important to cover because you might think it's a little strange, pediatricians talking about mom's health instead of the OBs, but we know mom's health is just really so important to the development and academic performance of babies and children as they get older.
Yeah, and not a lot of people talk about mental health and the importance it has. And I feel that, us as pediatricians, we are much more in touch with the parents at a young age after that baby is born versus seeing the OB.
Yeah.
So it's really important, and thanks for being on the little show with us.
Thank you for having me.
Yeah, so we just wanted to talk a little bit about postpartum depression. I know that there are certain screens available and things like that. Would you like to talk a little bit about what's available?
Yeah, absolutely. So postpartum depression is a really important topic, as you're mentioning. And a lot of people don't know the difference between baby blues and postpartum depression.
Right.
So maybe we could start there, and then I
Sure.
could talk a little bit about screening and my own experience.
Sure.
So baby blues typically, almost every woman has a roller coaster of emotions after having a baby because of the hormones that are going through your system and then the sleep deprivation. And it can be really challenging, the mood swings. And usually for baby blues, it lasts no longer than 2 weeks after your baby is born.
And does it tend to really start like as soon as, mom is, having her baby, baby's delivered, it starts right then?
It can, yeah.
It can even start prenatally too.
Yeah, absolutely.
Yeah.
Right. You can have mood swings and roller coaster of emotions even during pregnancy because again your hormones are all over the place. And so that's normal. And some of the symptoms there could be like, you're watching TV and you're watching something really happy and then you start crying out of nowhere. I remember for myself, I was watching a cotton commercial and I just started crying and I'm like, what the heck? Cotton is not sad, it's okay. So that is very, very normal. After the 2-week period, if you're still having overwhelming sadness, a lot of anxiety, like some women will have panic attacks, and they're persisting. It's persisting for longer than that 2-week period and is affecting your everyday work, your ability to be a mom,
Right.
To function, and that's when you want to start thinking about, is this postpartum depression or could this be a mood disorder? So there are many disorders beyond postpartum depression.
Right.
That you can get, yeah.
And we do screening here for moms when they come in from their first visit all the way through the first several months of life.
Yeah.
And one of the
That's amazing.
interesting things is that when a lot of times when the moms do the screening test, the screening questions, they come back positive for having depressive symptoms, and the moms don't even realize it. And I think that's one of the things that I find as a pediatrician most profound is that you can see it in the moms, but they don't recognize where they are even, and they sort of need some help to sort
Right.
of
To
help them
recognize it.
direct them and recognize
Yeah,
it.
absolutely. And that's one of the biggest challenges too, is that there isn't a lot of education around this during pregnancy or even before. And so a lot of women, myself included, really don't know the symptoms and don't know the difference between baby blues and a true mood disorder. And so you as pediatricians have a wonderful opportunity to, like you said, screen, because you have more touch points with the families than OBs do, certainly after childbirth.
Definitely. And just a little background for our viewers. Pediatrician screening for maternal depression didn't really start till 2014, 2016. So before then, most moms would have to wait till their OB visit, which is, 6 weeks? 6 weeks after being born. And now, we as pediatricians, we see the baby day 3 to day 5 after being born. So we're able to screen a lot younger, which is amazing.
Yeah. And unfortunately, less than half of the women in the U.S. actually are seen at 6 weeks by their OB.
Wow.
So you really have an important intervention point.
Mm-hmm.
And so for me, myself, being a doctor, working with moms and babies, I didn't even recognize my own symptoms. And so what benefited me was somebody else being really proactive and saying, hey, Jess, I'm noticing that you're not acting like yourself. You're
Hey, try not to say one word.
Oh, yeah.
And just sometimes having an outside person tell you, like, I'm noticing something different in your, how you're acting, how you're interacting is really, really profound and really helpful.
And it really underscores how it can be unrecognized. I mean, because you're a pediatrician yourself, and didn't recognize it.
Yeah, until years later, actually. And it wasn't until after my second child was born that I finally recognized it and started talking about it, and approached a peer who is another female physician to say, hey, look, I think I'm struggling here. Like, I need help. And so she helped me figure out what I was experiencing, which ended up being postpartum depression and anxiety, helped me find a therapist, helped me navigate it, really. And so sometimes it takes an outside person to tell you that.
Sure. So where should moms, once it's identified or we identify it with them, one of the things I think that our conversation is to sort of be proactive and sort of telling them, hey, do you want to discuss this a little bit? And I think I take a little bit of a history myself and sort of see how the moms are feeling and try to gauge how bad it is a little bit to understand how quickly they need to get help.
Right.
But from that point, as in where we stand as pediatricians, not being the formal physician of the mothers, it's sometimes difficult for us to know exactly the avenues we should be navigating. I mean, if you wanted to sort of discuss a little bit like what even a mom should be doing or who she should be talking to.
Depending on how severe the symptoms are.
Right.
That's a great question. So the Edinburgh postnatal depression screening is what you use, what is the standard of care and is what is used for screening. And so the score, it can tell you, if you score 9 or above, you're at risk. It's not a diagnostic tool. So like if you have a high score, you still need to go to somebody who is in the mental health profession to be able to provide you with that diagnosis, because it requires a one-on-one session with that person, additional screening, etc. So you really can't tell based on the screening how severe the symptoms are. Certainly that question 10 about if you have any thoughts of harming yourself or anyone else, that one can be really, powerful if it's yes. But for most women, it's a no. And one thing that's really important to know is that the media they choose stories where a mom, sadly, commits suicide or kills her family or her babies. That is so rare.
Right.
Not the norm. That's associated typically with postpartum psychosis, which is a completely different diagnosis and a completely different disorder than postpartum depression. So it's not like postpartum depression leads to postpartum psychosis. And postpartum psychosis happens usually within the first 2 weeks after birth.
Interesting.
So, so it's totally separate, and the way that the media portrays postpartum depression is completely not right.
They want the ratings, right?
Yeah. And so most women don't experience that I mean, they might have, so one thing I wanted to talk about is intrusive thoughts, and that's also separate. So when a woman has postpartum psychosis, that is something that they often don't recognize, and they act in such ways that are completely uncharacteristic of themselves, right? So, and it's totally different than postpartum depression. So something to recognize, and that I don't know that you would pick up on a screening. It would more be like interactions with that person or somebody who knows that person really well, recognizing that they're not acting themselves.
Right. And I feel that could be pretty common, right? Like I feel like this idea of postpartum depression, a lot of people may think, oh, that'll never happen to me, or that couldn't happen. But it's how often?
It's so common. So 1 in 5 women in the country experiences symptoms of they're called PMADs, perinatal mood and anxiety disorders. And so not just postpartum depression, but anxiety, PTSD, OCD, there are a ton of disorders in that umbrella term.
Yeah.
So 1 in 5 women. And then among women of color, it's up to 3 in 5.
Wow.
So then, when a mom sort of recognizes where she's at and
Mhm.
could use some help, what's her best avenue
Mhm.
that you would recommend that she does? Should she talk to her
Mhm.
primary care provider, her OB? Like,
Mhm.
what's that first launching point for them to gain access?
That's a great question, and so we might want to talk a little bit about mommy
Sure.
in the next segment.
Yep.
But right now, unfortunately, in our country, there isn't a great place where providers like you can refer. So oftentimes, what happens is providers will do the screening, they'll screen higher risk, and then send them to a therapist. Oftentimes, women are just wrapping their heads around the fact that they might have postpartum depression and they're not ready to go to a therapist.
Right.
But most of the time, they do get referred to a therapist.
Okay.
Now, what the issue in our country right now is there's a huge shortage of mental health providers, especially
Right.
after COVID and a lot of people having mental health concerns. So it's hard to find. It's really hard to find a perinatal therapist, somebody who's trained in this area. So there are a lot of moms who go to therapists who are not trained in this area, and they get really turned off by certain things. Like they get threats of being reported to Child Protective
Yeah.
Services, these types of things,
Right.
And so it's really important to find first of all, make sure the mom is ready to go to a therapist or a mental health provider, a counselor, somebody who can provide a formal diagnosis. And then, so she has to be mentally ready, and then also finding someone who works with the perinatal population.
Yeah, and even, there's some other hurdles too, like, will insurance cover it?
Mhm.
Is mom being truthful, or like you said, ready to talk to somebody?
Mhm.
Because a lot of parents, and even, kids, we see it in the practice, they don't want to talk to a therapist, they don't want to open up. So finding the right person, I think, is hard, just finding anyone in general too.
Yeah, absolutely.
Yeah, I think the key take-home message here is we all have to be honest with ourselves, and it's all for the betterment of the mom, the baby, the whole family.
Yeah.
Um,
So it's important to screen, like we said, and then once we screen, we need some mental health support. You mentioned briefly mommy that we're going to talk to about in part 2 of this podcast. But maybe we can just kind of hint a little bit overall big picture, and then I'll post a video either there or there to the next video. But why don't we give like a quick little overview of what mommy is?
Okay. Yeah. So.
Or why did it even start?
Why did it even start?
Yeah.
That's a great I think intro to it. So I alluded to the fact that I was helped by a peer, a female physician who really helped me when I was struggling. I believe that peer support is really, really powerful. So like think about different peer support models, like AA, right? AA is completely separate from what we're talking about here,
Right.
but it is a powerful evidence-based peer support model.
Successful.
They're successful, exactly. And there are other models like that. And so what hasn't been applied to maternal mental health yet, and in a digitized way, in a tech-based way, is peer support. And so what we're doing at Mommy is providing new mothers with maternal support from other peers, like moms who we train to provide really high quality advice. And so for me, when I had a friend after my first postpartum period, I was texting her back and forth. She was going through the same thing as me, but we were struggling to figure it out together, right? And so like oftentimes the people who are accessible to you are on maternity leave and are experiencing the same thing, but neither one of us knew what the heck we were doing. And so these moms who are mommy coaches, they provide support. They've already gone through that experience. They've gone through training. They know where to direct moms and what resources to point them to, and really good advice. And so that's what we're facilitating at Mommy. The other thing we realized at Mommy is that peer support is great, and women really, really benefit from it. But then when they need a therapist, or when they need a lactation consultant, or we have doulas, midwives, other specialists, then we refer them out. We would refer them out initially, and they would have a hard time getting an appointment. So we have those people under our umbrella as well. So our coaches can directly link them and get appointments with them quickly.
That's amazing. That's great.
So I think we'll stop there for now, and we'll talk at part 2 a little bit more about mommy and the problem it's trying to address and help moms with.
Yeah. So we'll see you in the next video. I'll put the link up there, and then in the description down below, I'll put some links to videos about what mommy is and a little bit more information about it.
Okay. Make sure if you like this podcast that you subscribe to our YouTube channel and tell us what you think. Until next time, I'm Dr. Jeffrey Kyle.
And I'm Dr. Alvaro Raimonde.
PAK Pediatrics. Thank you.